Welcome back. It's incredible how far we've come in the field of medicine and more specifically in dentistry. Aeris Family Dental is on the cutting edge with their techniques and technology, and here to demonstrate how is dentist Dr. Lan Allen. Doctor, thanks so much for coming back.
Thanks for having me, Alex.
Nice to see you here. So we're talking about crowns and the different materials that are used these days to sort of fit them and make them. What types of materials are used these days?
In the past, we've gone everywhere from a full metal surrounding crown that it was, say, like gold, and then you'd have a metal crown, you'd bake powder and liquid porcelain on top of it, and then we moved to kind of monolithic or one-piece materials that were milled out. Yeah. And so now we are in two main products: lithium disilicate, and one is zirconia, and that's where we're focusing most of our attention nowadays.
And so what's the benefit of using these types of materials?
Well, zirconia is, again, one piece. It's milled out of a block or a puck, and it can be very, very strong. We know the material, we know what it is, we know how it's going to perform, and we're even getting it better and better looking nowadays. It's the same material as, say, like fake diamonds, cubic zirconia.
Okay.
And so we're even getting it to look better and better every year.
Now, do you mill these in your office, or is there a lab that does these specifically?
We do them in the laboratory,
okay.
Because that's where the strength and the focus of manufacturing and materials can be really perfected. And so there are some that can be done in the office. We've chosen to have the laboratory do those, and maybe it'll kind of demonstrate a little bit of why we do that.
Yeah, and so you've brought a couple tools here, obviously not representative of the tools you'll be using in your office, hopefully. I mean, I guess most extreme cases,
medieval dentistry
you'll need
here.
that.
Yeah,
but you're actually going to show us the durability using this hammer and the screwdriver.
Yeah, are we ready to do this?
Yeah, go for it. I'm going to put these on too.
Yeah, just for, last month I had a piece of porcelain go in my eye, so.
Did you?
Yeah, just be careful
what
there.
What a tough guy, and here he is today. All right, let's see what we can do. So show us first what we're going to do here.
So we have two identical crowns. I have a couple in this one of the same material.
All right.
This is the lithium disilicate, which is pretty common in the in-office milled.
Okay.
But I went one step further. I had my lab mill it at his, with his professional equipment, and I said, you got to give me the best one possible.
Excellent.
So this actually does really, really well. It takes a couple of hits and then it'll break, but we're just gonna, why don't you hold that in for me, Alex?
Okay, I'll ride the horse.
Ride the horse, yeah. Ready? All right, here we go.
Whoa.
So that one,
okay.
One hit.
That one's chipped.
That's the lithium disilicate.
Okay.
That's one that would be representative, one that would be milled out.
Right.
In the office, whereas this is demonstrating, hopefully live television, hopefully don't get burned here. So here we go. This is the zirconia.
There you go. Look at that.
Went right down into the wood.
Toughest corn on the cob stands no chance against that one there.
So if you want to come over here.
Okay, you kind of labeled it nicely for us.
So this is the previous test here. This one's kind of fractured out.
Yeah.
I kind of opened up the wood a little bit, but we can just pry this out.
Wow.
And it's perfectly intact.
Look at that. Essentially no damage, not essentially. Look at that. The wood's all chewed up.
Yep, and it's still, that could actually, they've gone and measured it down to the microns, and this could be used after that hit. Just
incredible. And so the idea is they're very durable. And have you done these types of tests before?
They've been done on through national laboratories on a large scale, very controlled with a big sledgehammer. We've done similar things. We're a part of we are the laboratory or the office for a national laboratory to do their testing.
Great. Okay.
And so they will send us, here's our alpha test, here's our beta test. And
they said, get Dr. Allen out there with the sledgehammer. Let's have him try it out. So if this material is so strong, why would it ever have to be replaced?
So we don't anticipate the crown to fail, as you can see.
Yeah.
It really holds up. What can fail is the tooth that's underneath.
Yeah.
And so someone that doesn't take care of their teeth, doesn't floss, doesn't brush, have some other issues like that, or even some medical issues that can contribute to dry mouth and cause cavities, their teeth can fail. But as you can see, the crowns typically are not.
Crown's pretty much set for life, right? I mean, you don't ever really have to do anything.
As long as the tooth is good, the crown should do well.
So take care of your teeth is what the doctor's saying. And of course, we can't let you go without talking about the great treatment estimator that you guys have, because it can be so confusing how much the cost is going to be if you go to a different office. But tell us a little bit about how this makes it easy.
So you can go to our website. We've built this tool, and they can select a procedure. And then you can say whether or not you have insurance, either way, yes or no. And once you select that procedure, select your insurance, we kind of chew out and spit out a number there just to give you, we try to get as accurate as we can, and we're getting better all the time. This is where we put our research money, is to really getting these kind of things right. And but we're getting better and better all the time, but it'll get you pretty close to the ballpark.
Right. I mean, at least you'll have an idea. You won't be going into it blind. It'll really sort of help you plan ahead. So, doctor, as always, cool demo. Thanks for bringing this. This is a cool idea.
Hey, I'm glad it worked.
And I'm going to let them know how they can get in touch with you. Thanks again.
Thank you very much.
Nice to see you. Now, if you mention the Morning Blend, get a free exam or second opinion. Plus, through the end of January, you can get a crown for $650 and learn more about Aeris Family Dental by visiting TucsonTeeth.com.